Hello, hello, and welcome to part 4 and the series finale of the ABCs of OOO. When Docs Talk is happy to present the last piece in the series. We are excited to bring to you the answers to all of your questions. You asked, we're going to answer. Between the WDT host and our wonderful guest, we have put together a summation of all of your questions that you want to know about women's sexual health. Welcome to When Docs Talk, the ABCs of OOO.
When docs talk, when docs talk, when docs talk, when docs talk. When docs talk, 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 when docs talk.
All right, so let's jump into what we came to talk about. We came to talk about the ABCs of OOO. We want to know what you know about the big O and what you'd like to know about the big O. And in that, we are here to answer any questions you have, but we're also going to be joined by people that this is their specialty. They have so much wonderful knowledge to impart to you.
This is why tonight, this isn't just fun and games. This is so vitally
important. Absolutely. And I wanted to ask Dr. Whaley something about that, because there are two questions that came to mind when you mentioned the pain. I want to ask our pelvic floor PT therapist if there are things that women can do that will help them from a pelvic floor standpoint with any pain associated. And then, of course, bringing it back to the joy, are there any things that they can do to help with their orgasms from that perspective? Particularly
100%.
Those who have had children or had any other stressors on their pelvic floor.
For sure. What you're talking about, Dr. Julianne, pelvic pain, that's what I see all day long. So that truly is my passion. And one way that pelvic pain manifests is sexual dysfunction. And so commonly, sexual dysfunction is related to overactive pelvic floor muscles or hypertonic pelvic floor muscles, high tone. These are all just words for it, but think like muscles that are literally too tight. And so when your muscles are too tight, this goes across the board. There is a healthy, what we call muscle length tension ratio. So this applies to your hamstring, this applies to your abdominal muscles, your calf muscles. There's a happy medium equilibrium as far as where muscles function for us, and they're healthy, and they can contract when they need to, and they can relax when they need to, and they can be functional. When this is not happening specifically within the pelvic floor, it causes pain or discomfort with sexual outer course or intercourse. And so that's when my patients come to see me. I hear that constantly. I can't have pain with my partner, whatever said partner, at all. And so it's dyspareunia, as Dr. Julianne mentioned earlier, dyspareunia, pain or discomfort with sexual outer course or intercourse. So that's what I'm seeing. And so risk factors, I just want you all to kind of keep this in mind. In conjunction with just having muscles that are tight, it often has to do with an upregulated nervous system too. And you think about COVID-19 and just how stressed we have all been the past 2 years, we're manifesting that literally within our body. I saw a change in my caseload during that entire time. But anyways, thinking about risk factors for an overactive pelvic floor that can lead to sexual dysfunction because of tight muscles, there's endometriosis, there's PCOS, there's fibroids that are risk factors for this. There's the pregnancy and postpartum phase that are risk factors for this, just because there's changes within our tissues, our muscle tissues more specifically. There is intense core activation, intense exercise activity that makes us a little bit more privy to having a high tone pelvic floor. There's trauma of all sorts. We talked about religious trauma, sexual trauma, mental trauma, emotional trauma. Those are all things that can be risk factors. Low back pain, hip pain. So these are all the things that I'm treating within my framework of treating sexual dysfunction. And the way that we do that is honestly a lot of manual therapy. So that's one thing that's literally me getting my hands on people and pelvic floor therapists. This isn't every pelvic health or pelvic floor therapist, but we do a lot of internal work to the pelvic floor. The same way that you would have soft tissue mobilization of your hamstring or your abdominal muscles maybe, or an ankle, whatever the case may be, specifically a calf, whatever. We do that to the pelvic floor muscles too. But we can't neglect the rest of the systems that are involved within that. So having a nervous system that is a little bit more sensitive and overactive in its natural resting state, we have to address that. We do a lot of breath work. We do a lot of down training of your entire nervous system within what we do. Exercise is a great healer. So we're looking at all the deficits that come about in our body, not just completely focusing on the pelvic floor, but external to that. Do you have hip pain? Do you have back pain? Do you have constipation issues? Do you have urinary issues? Because commonly that has to do with sexual dysfunction or pelvic floor dysfunction in a broader category. So we're addressing all of these things within this framework, and we're specifically looking at the pelvic floor. So there's a lot of it, and it's very holistic. And then if we're talking about menopause, for example, we're going to start talking about libido, and more specifically, if that whole thought of like, if you don't use it, you lose it, like that's very important when we're talking about the clitoris. The clitoris is a game changer. So sometimes in my homework with clients, I do have to also prescribe them homework as far as masturbation. It's a thing that you can do. It's healthy, and it helps your tissues bring back and rejuvenate their natural blood flow. So there's a whole host of things that we do. It depends on how the client comes in and what they're complaining about and what all we can do for them and what they have space for. But that's a lot of what we do in this practice.
That's amazing. And you just hit on several of the questions that have come in. You hit on menopause. You've hit on a couple about masturbation. So this is what I want to do. We have questions we promised our viewers we'd get to. I want to take a quick break, and we're going to come back and answer some of those questions, okay? In our break, and we'll see you after this. Don't go anywhere, because we will answer your questions. We got them here, okay? We've seen even the ones that came in anonymously. What we want to do in our break is we want to put a spotlight on our own Dr. Pierce. She has written 2 books. One of them is To Whom It May Concern, Thoughts of a Psychiatrist, Allegory of Mental Condition and Activity book. She's also written Hues of Mental Illness, Mental Health Activity and Coloring book with conditional descriptions. We want you to know you can find these on her website, www.alignedcognition.com, or you can get them on Amazon. And with all this talk about sexual health, we want to also remind people to stay safe. Part of sexual health is making sure that we're making good sexual choices. So as much as we're talking about, sex toys and lubes and positioning and arousal, remember that we need to make sure to keep ourselves safe. Protected sex is safe sex, and that is healthy sex. So please remember that too. Now, I am just going to throw up the questions that our viewers have asked us, either online anonymously or in the survey anonymously. And I will let whoever take it from there, okay? So the first question that I have from one of our viewers is, why is there so much negativity towards oral sex?
I think I'll answer that one. A lot of that has to do with the way that people were raised. And you have to remember that back in the day, when your grandmother or great grandmother was having sexual intercourse, that was her job. That was the thing that she had to do. And one of those things did not include putting her mouth on anybody's genitalia. And that has become such a taboo thing in that type of age group that it kind of trickled down to the other age groups as they were getting older. So it really has to do with generational trauma, is what I like to call it. And that's something that we all have to try to get over, because oral sex is a part of sex. It may not be something that everyone likes, but it is something that people can and cannot do. And I think a lot of people also have a problem with oral sex because they never learned how to do oral sex. There's no to do, well, I guess there are to do books and to do diagrams nowadays, but before there was no tell me how to have oral sex, tell me how a man should have oral sex or a woman should have oral sex on me, or tell me how I should have oral sex on my partner. There was no way that you can know those things, and when you don't know something, you're naturally scared. So again, it has to go back to the mind. I'm going to always bring it back to the mind because that's what I do.
Right. But you know what? You don't think, lady, I'm going to ask everybody, including our host, you don't think there's a cultural component to this?
I was just
talk about that, Davida.
I feel like a lot of times with Black women specifically, it's always deemed like, oh, Black women don't like giving oral sex. Why is that? It's always assumed that, you know, our other cultures are more accepted in being, you know, I'm not gonna say proficient, but just better at oral sex. But when it's like, okay, I'm dating a Black woman, and I know that she probably won't like this. Why is that always the case? I don't understand that part. I don't know where this assumption came from or where it was stemmed from, but I know that it is assumed by a lot of people that deal with Black women.
Morgan, get in there. I see her.
She's ready.
I'm a different generation from you, Davida, and I can say that when I was coming up, that was definitely a negative. You were viewed negatively if it was found out that was something you did.
Right.
It was not something that, you know, good girls did when I was coming up. So if you did it, you weren't truthful about it. You know what I mean? It was a derogatory thing in our minds. So I mean, this generation is real. Like even in the rap music, all that. I mean, it's out there. That was not the case when we were coming up.
See, I grew up in a multicultural environment, and among certain ethnicities, like if I was among certain ethnicities, it was cool. Everybody, it was assumed that you did it. In fact, you did it so that you didn't lose your virginity too soon, right? So you have oral sex instead of having intercourse. And then in other cultures, they're like, oh, that's way too personal. I would rather have intercourse than do oral sex because oral sex is too intimate.
Right.
And so it really was cultural because I grew up around white people, Black people, Latinos, everybody. And it really depended on which group. But I agree with you, Morgan. It could be a generational thing too.
Yeah, absolutely.
Can I just add my little tidbit about it though? I'm glad you brought it up though, that people think, you know, young folks are thinking I'm still a virgin because I'm not performing that. But here is the negative part about oral sex. Womp womp, here I go. STDs or STIs, sexually transmitted infections. I will swab a young girl's mouth
all the time.
Her throat. I'm swabbing it because no one is performing oral sex with condoms on a penis. And so, and not only that, you know, newsflash, literally, when I was in medical school, oh my gosh, which is now 21 years ago, when I was in medical school, we talked about the difference between HSV or herpes simplex virus 1 versus 2. And unfortunately, because of the prevalence, I'll say, of oral sex, stop telling people, I'm not getting on my ER colleagues or my, you know, FP colleagues, but stop telling folks, oh, you just have the oral type. 1, it's not just oral, and 2, it's not just genital any longer. Because if I perform on you and you have 2, but I only give head, where am I going to get 2? In my mouth?
Right.
And vice versa. So as long as, and you just mentioned it at the end of the commercial about safer sex, right? The only safe sex, I heard it on MSNBC yesterday morning. I don't know who this woman was because I was driving, but she said, it is not safe sex is no sex. So let's talk about safer sex. Safer sex
That is
is
true.
knowing your partner. Safer sex is limiting your partner. Whether you're monogamous or not, your choice, your body, your choice. But safer sex is what we're talking about here. And so if you're going to perform on somebody, you need to know their status of everything. And they should know yours as well. But I agree with the sentiments here because I'm seeing all ages. But trust me, the older generation is performing probably just as much or more.
Oh, yeah.
They've come up with the times. We may not have known about it.
It's not the taboo that it was. They may not tell you about it. They may not be oral about their oral. But they're doing
Bam.
Got it.
The other thing I think but just 1 second before we go on. The other thing I think that a lot of women need to know, especially if you have teenage girls, there is a game right now where the young ladies will put on different color lipsticks and they will see who can get down the furthest. So you need to talk to your children about the fact that oral sex does mean. Yeah, they're verbal.
What's the name of this so I can make sure my daughter never?
Isn't it Rainbow?
It's called Rainbow. Yeah,
it's Rainbow.
I've heard of it. I've heard because we see these kind of things in the email. But they use the lipstick to see how far down, and whoever's lipstick color was the furthest down is the one who wins, right?
Yes. And so we need to talk to her. We need to talk to our young girls because, like you said, some of them think that they're doing the oral sex so that they can remain virgins. But if you have any type of sex, you are no longer a virgin. They think that because my clitoris, not my clitoris, excuse me, because nothing was inserted into my vagina, that means that I am pure and that I am a virgin. But if you're doing other things, you are not a virgin. Your mouth is not a virgin. Like Dr. Burt said, you can get STDs in your mouth. So we need to educate our younger girls too, because they're out there doing it.
Absolutely. That's
to the same person.
And I've also delivered in my lifetime. I've delivered 2 women who never were penetrated.
What?
Yep. Yes.
My cousin.
For that.
Okay. That sounds horrifying. Okay, what about this G-spot?
It does exist, right?
Somehow it keeps leaving the screen. There we go. All right. So is the G-spot a myth? We talked about different types of orgasms, and one of them was the G-spot orgasm. But some of the ladies that sent questions, they say the one question they had was, how can I have an orgasm or penetration with intercourse alone? And that same person asked the question, is this G-spot a myth?
I think it's one of those things that's controversial. So I'm a part of a organization, an International Society for the Study of Women's Sexual Health. Even amongst the experts, and most of us on there are very well versed in female sexual health and dysfunction. And you will have experts arguing about the G-spot. But they will also be arguing at the same time about female ejaculation too. So everyone thinks of it in a different way. But many women do. I'll say it this way. I believe that many women do have an enhanced spot around the urethra called the G-spot. The Graafian spot is what the G stands for, around the urethra. If I didn't believe it, I wouldn't be doing the O shot. Just stimulate it. And I have helped women find it. You should all. The conversation about masturbation, we could kind of have the same conversation about masturbation like we did with oral sex. But how can I teach you how to pleasure me if I don't know what pleasures me, right? And so the G-spot is one of those things. How do you know what positions work for you if you don't know what positions work for you? And you can find that out. It's fine if you find it out with a partner, or you can find it out for yourself, and now you can direct. So it is not a myth. I have helped plenty of patients find her G-spot just in my office. And so if you want to...
I'm laughing because 2 of our hosts were like, oh, you're going to have 2 new patients tomorrow.
Yeah. And it's also why certain positions, the missionary position may not do it for you. It may be better if your partner is coming from the back, or you're inserting your toy in a different position, side, back, whatever way, because of the pressure. So when you put pressure on the anterior, which is the top portion of the vagina, there's that the G spot can also push forward and give you clitoral stimulation as well. And people, it still baffles me how many women are so upset that they can't have a vaginal orgasm. And I tell them most women have clitoral orgasms, even while being penetrated. It's your position. And so you're stimulating, your partner is stimulating you in a different way, but they kind of call it, well, but I was being penetrated, so they think it's a vaginal orgasm, when it really was almost what do you call a deferred reaction, if you will.
Dr. Bird, I have a question for you. I was always told that the G spot was somewhere near the anus. That's not true? Okay.
That's another spot. And people are stimulated with anally as well, but no, it's the Graphian spot is on the upper portion, where underneath the urethra, where you urinate from.
I was always taught, just on that before we move to the next question, I was always taught that if you're thinking about the G spot, if you insert your fingers into the vagina and turn your fingers upward and do like this motion where you're beckoning, come here, that you could access the G spot that way. Is that right?
Exactly. So that
is correct.
So now you took away my secret. People not gonna come for me to find it. I'm just
They're gonna find it, but still come and get the O shot.
There you go. But yeah, so you said it exactly. You think about the first crease in your finger. If your partner does that and then lifts up, then you'll be able to find it. Should be able to find it.
Before we go to the next one, I did want to ask Dr. Whaley. The question mentioned, penetration, and she and I have worked together. She's my therapist. She's wonderful. The one of the things that she does is that she checks the intensity of different levels of your pelvic floor in her exam. And I was wondering, could you kind of explain it just a little bit as far as how that would help out during the actual penetration portion of sex?
Gotcha. So yes, there's different layers of your pelvic floor muscles, and they should be engaging. They should be contracting. And there's literally 11 pelvic floor muscles. Like I said, the more superficial ones are helpful with clitoral erection. The deeper ones are helpful with orgasm, like specifically, they're a little bit larger. So we're looking for how well they can engage. So I'm pretty much asking people to do what we have colloquially thought of as a Kegel. Now, I also want to say that Kegels are not appropriate for everybody. Like, everybody should not be told to do Kegels at all. That is a misconception. Like, some people live in a higher resting state already. And again, like I said, you don't want your muscles to be too tight. You don't want them to be too lax. So I'm looking for the strength of your pelvic floor muscles, basically, when I have you do a Kegel. And we can talk about trying to engage different ones more specifically when I am palpating, basically. So a strong orgasm, you need a strong pelvic floor to do that. But I did not say tight pelvic floor. I said healthy, not tight.
Healthy.
Strong. Strong is different than tight. Tight is weakness.
All right. Somebody mentioned something about the anal region. There's another spot there. And so one of our viewers, actually 3 viewers, asked this question. So I tried to summarize it. One said, is anal sex safe? Another one said, is there a safe way to try anal sex? Does anybody want to comment on that?
Condom.
Hey,
Condom.
that's it.
Yep, that's it.
Think about, so you mentioned monkeypox at the beginning, and we of course know how HIV is transmitted in the early 80s, what was happening. There are more vessels in the anus. I would not be trying this out without being in a loving, safe, healthy relationship.
Right.
Because HPV, the most common viral infection that we do not think of as a sexually transmitted infection, is a sexually transmitted viral infection. 95% of sexually active women sometime in our lives will be positive for HPV. I didn't say you will test positive for HPV, but because you may come to see your, get your pap smear at a time when you're outside of that window. However, 95% studies show of 95% of all women who have had intercourse have had some type of intercourse, not oral I'm speaking of, but vaginal or anal. And I'm saying that strongly because HPV is that prevalent. So I don't give the how-tos. That's not my job as a gynecologist. I do want to say, if you're going to try it, you're trying it because you trust the person that you're with and that you're going to do it safely with a latex condom. Women who have that, some women, let me make it clear that you can get anal dysplasia and anal cancer, which is on the rise, even without anal penetration. Did you hear me? So if you have such a high concentration of HPV, human papillomavirus, it can affect the anus, and it is on the rise. Anal dysplasia and anal cancers are on the rise. So that's my little tidbit on that.
I just want to make one correction. Not everybody can use a latex condom, so make sure you're using the condom that you can actually use. There are people who are allergic to latex, so there are plenty of condoms. They have lambskin. They have the I like to show diagrams to my patients. They have the Skins. Skins is a non-latex brand. So make sure that you use the type of condoms that you can use, because you do not want to have other medical conditions happen because you're trying to enjoy yourself. But you must use a condom with anal sex. And you, like Dr. Bird said, you have to have a partner you trust. You must also use a lot of lube.
Yes.
People do forget that you need to use lube. This is not something that you should try dry, basically. You have to use lube. The other thing is that if you are in a safe relationship, then this should go slowly. This is not something that is, let me just kind of whip it out and put it in your anus. This is not what the time for that. There should be slow transition with either, one time we're just using our finger, we're using one finger, we're using two finger, we're trying to extend the muscles and get relaxed. There's several different things that you need to do in order to try to have safe anal sex. But the biggest thing is condoms.
I'm so glad you said that, because I was definitely agreeing with Dr. Julianne about the condoms piece, but I'm glad you mentioned the lubrication piece, because just from an anatomical standpoint, it's a very sensitive region. Dr. Burt mentioned there's lots of blood vessels, but the tissue is also very sensitive. So I love how you underscored, Dr. Jasmine, that people need to go slowly, need to use lots of lubrication. It's not something you rush. And I agree with both of you when you say it's really probably something that's safest and healthiest in a relationship that's committed. There are two questions that are similar. I want to put them up because we have to talk about sex toys a little bit. One person said that I find sexual toys to be cold and not intimate. How can I change this? Am I alone? I am alone and would still like to enjoy sex. And another person asked in the similar light, can regularly using vibratory devices cause desensitization and pain? So this is questions about sex toys.
Well, I'll take the first one for sure. Warm it up. Who told you couldn't put it in some hot water? Warm it up. If it's not warm enough for you, then warm it up with some hot water. Get in the shower. Most sex toys now are water resistant or either water repellent. So get in the shower. There's no reason that this can't be enjoyable for you. That is not an excuse. That is cold and not intimate. The intimacy part is you with yourself. You have to learn yourself first, and that's where the intimacy comes from. And then the coldness, like I said, just put in some hot water.
And there's so many toys out there.
Oh, so many toys. Want me to show you one?
Oh my gosh! Yes.
I do. Sure. We'll show you one. I got here is the Rose Babe.
Okay.
Okay.
All right, Rose Babe.
Hold on, let's make you bigger. Let's make you bigger. All right.
So here's the Rose Babe. It is a clitoral stimulator. You would put this part just around your clitoris. So basically, if this is your clitoris, you're putting it around your clitoris, and it has a slow suction and goes through different types of suctioning. And then it has, I ripped it, trying to do a demonstration for somebody. I ripped it right off, but it does have an actual tongue that vibrates. And so you get different vibrational, sensations from the tongues. And this is not even one that I highly recommend. I highly recommend the Leo Sono, which I've actually put in one of my books, which is a clitoral stimulator as well. But any type of clitoral stimulator, you just have to be willing to try something out. And again, it's about learning yourself first. Most times you would need to try your sex toys with yourself first before you try it with your partner. There are some toys that are meant to be for couples, but there are other toys that are meant just for you as a woman, and you want to sit there and you want to try to use it on yourself first so that you know and can explain how and why this feels good, what doesn't feel good. I don't like it there. It's too cold. Whatever the case may be, that's why you try it out with yourself first.
Okay. I love that. We have another question here about the vagina. Basically, how can I safely clean my vagina to get a smell that I'm comfortable with? They say not to douche, but I really don't like my natural smell.
So dishing has been out since the late 80s, but grandmamas still tell their girls to do it.
With the vinegar.
So the reason being is the thought is not just the ingredients, but it's the force of the fluid, and you can cause infection. You can increase infection that way. So here's what I have found, and this is my N of one, my practice N of one, not a study. But I think one of the many problems that we're having now, and why people still want and have the desire to dish or to do something, is because we call your menses, right? Your vagina is naturally cleansed because of the menstrual blood. The problem that I have with that is in 2022, many women are not using sanitary napkins. So blood is not coming down the vaginal shaft. I call it, you're plugging it up with a tampon, or we're using the cups, the Diva cups or whatnot. And so there is no cleansing of the vaginal walls. So what I encourage, especially the teenagers, the young girls starting out, is to get in a tub of water. Most of my patients, heck, me, shower. We rarely bathe. And by doing that, we know our anatomy now. We talked about it. And you're standing up and water is flowing down. So even if you take a nice sponge, there is no way that you're allowing water to flow inward. So I just encourage, especially teenagers, to take a bath at the end of their menstrual, at the end of their menses when it finishes flowing. Get in a tub of water, because that's part, I think, again, my N of one, that a lot of what we're seeing, smelling, discharging, all of that is because we are lacking what the normal flow has been.
Okay.
I have a question. What are your thoughts for any of the hosts, for any of the guests today, about chlorophyll, fenugreek, and boric acid suppositories? Because that's now like the new trend.
It ain't new. I tell people to use
it. Okay, it isn't new. It is.
I'm glad. TikTok and Instagram. Folks come in and I'm like, so do you know about, I'm thinking I'm telling them something. I'm like, oh, is that really real? I'm like, yes, if you want to stop having all these recurrences. I will tell you, at our conferences, the American College of OBGYN, it is a packed house when they have that seminar. talking about, how to help your patients with recurrent BV, bacterial vaginosis, because we're all like pulling our hair out. How do I help my patients with recurrent BV? It's difficult because, as one of our presenters several years ago, pre-pandemic, said, it's like telling somebody, oh, take a toothpaste, and today, if you brush, you're good all, for the next 2 weeks. Sometimes you have to do something daily in order to keep the vaginal pH aligned. So probiotics, yogurt. I prescribe yogurt. I tell them, just don't get raspberry flavor. Just use some good old generic plain yogurt. Take a tampon, dip it in there, and place it vaginally for maybe 15 minutes at a time. Or if you want to take a probiotic and see if that works for you, do wash, but you may not want to wash with Irish Springs. You want to use a feminine wash, honey pot, if you want to, that line, or Vagisil, or Summer's Eve, or
just use something at this point
as on a regular basis. I got you. I'm gonna close with one same line of questions. I got 4 questions similar. Okay. And they were, how can I discuss erectile dysfunction with my partner? And are there ways to have pleasurable sex with a partner who has this problem? I had different permutations of that same question.
Dr. Kears.
Okay. Yeah, sure. I'll take it. So to have that conversation, number one, you have to be comfortable with your partner. It shouldn't be a question of how can I discuss this with my partner, because if you're in a relationship that you're comfortable with and the both of you are having these very adult and normal conversations, it should come with ease, where you should be able to tell your partner, hey, there seems to be an issue. Let's talk about this. And your partner should be willing to listen to what your feelings are about it, tell you what his feelings are, and then come up with a solution. The solution usually being him going to the doctor. But we don't have that normalcy where we can have those conversations. So erectile dysfunction is not something that is going to just go away. It's a little different than female sexual dysfunction, where you can get therapy, get pelvic PT, get the different medications that we're talking about, other medications that I prescribe to help you to try to get rid of your sexual dysfunction. Erectile dysfunction, you have to find out the reason first. The biggest thing is to find out whether or not it is truly erectile dysfunction, or is it that your partner is not actually sexually attracted to you, or is your partner not being aroused by you? And that can happen, and people find that out once they get all the test results back to say that there's nothing wrong with the penis. So we need to have normal conversations, and we need to be able to just regularly check in with each other, no matter who your partner is, and find out if something is not going right, if something's going wrong. And for those that do have partners with erectile dysfunction, there are several different ways that you can still enjoy sex together, because again, there's foreplay, there's intercourse, and then there's the post play. So there's so many things that you can do from beginning to end that doesn't exactly involve penetration. It's just that you have to learn yourself again and your partner.
And I want to add, also the sex toys can also be incorporated. It doesn't have to be only for masturbation. Some of the toys that you mentioned could be used with partners, right?
Right. Yes.
But let me add though. Let's think about this too. Erectile dysfunction is oftentimes a vascular dysfunction. So by the time your partner has erectile dysfunction, I'm concerned what else has been going on and for how long. So have they been checked? Especially if we're talking to African American communities, our partners are not always gonna be going to see their own doctor. So what's going on with their cholesterol, what's going on with their if they have hypertension, diabetes, we need to manage these things, and we need to discuss things. We need to be proactive and not always just talking on the back end. And I'll say that it's not an ED statement, but I tell that to women who'll tell me, when I say, oh, what's new this year? Well, I'm divorced. I start talking to her. I normalize self-pleasuring. I normalize it because I say to her, well, you know, if 80% of women who become menopausal will have vasomotor symptoms where they experience hot flashes or night sweats, 50% of those women will end up getting GSM, or genital urinary syndrome of menopause. So dyspareunia can become a thing when you lack the estrogen. So as it was stated by Dr. Whaley, if you don't use it, you'll lose it. We got to keep you stimulated. We got to keep it going, right? So I have those conversations with my female patients. As the loving partner, you may want to say, well, honey, you're 30, you need to go to the doctor, because when you're 40, and I know I'm throwing out generic numbers, but it's what I remember. 40% of men by 40 have ED, 50% of men by 50, 60% of men by 60. That doesn't mean they'll never be able to get erect, but it becomes problematic. So we need to start having these conversations, and maybe, just maybe, you'll be able to encourage your loved one to seek healthcare sooner rather than after the fact.
I want to add to both of their knowledge, but also, as much as ED can be very much a vascular dysfunction, we also do have to consider the pelvic floor muscles within that too. And so that does contribute. Like, you can have dysfunctional pelvic floor muscles that are limiting the way that your penis can become erect. So there is pelvic health PT. There are pelvic health physical therapists who do treatment as well for these types of dysfunctions.
I'm so happy to know that. I had no idea. So that I think whenever we think of pelvic floor PT, we always think of women, but I'm so glad that you remind us that men can benefit from it too.
That is one of the main things they treat.
Let me tell you, I have learned so much. Our viewers, most of their questions were answered. Of course, there's some that they could not answer, but I'm going to collect them and see if we can put them up on our site. What I want to know from you all, and I want to thank you all so much for joining us, but I want to know what final thoughts or what final pearls of wisdom you want to leave with our viewers.
Well, I'm going to say, find help, ask the questions. I didn't touch on this earlier, but we know that women don't bring up their sexual dysfunction to their physicians for a myriad of reasons. They're uncomfortable. They don't want to make the doctor uncomfortable. Because they only have a limited time. Doctors don't bring it up, patients don't bring it up. And I think it's important that you do. If you're going to your doctor specifically just for your pap smear, which usually is under the umbrella of a wellness exam, you're not going to see him or her for another 365. You're going to go another year without enjoying your sexual health. Your sexual health is just as important as your mental health, your physical health, your emotional health. It is important. So please, please, please ask the questions. People suffer alone, and you don't have to. You do not have to, whether you're 25 or you're 65 or you're 85. Do not think the number one reason why women don't bring it up. I just looked at a study today in preparation. The number one reason why women don't bring it up is because they think that their problem is temporary. They don't think that it is something that's going to continue on. And when it does, 4 months becomes 4 years, becomes, it's been since we were 40 and we celebrating our 50th anniversary. So you get my point. Just ask, seek the help. You know tonight that it's there. So good luck to you. Thank you all.
Thank you, Dr. Julianne. I have right over here. Let's put her into view.
All right.
Cheers.
Yes.
What do you leave with our viewers?
What I would like to say is that, number one, I think all viewers need to know that psychiatrists are actually medical doctors. A lot of people are unaware of that. So I want to point out that I am a medical doctor. And just like Dr. Julianne said, you need to ask the questions. You need to bring it up. And so you should be comfortable with it. And those of you that are going to a psychiatrist, it is okay to talk about sex with your psychiatrist. I asked during my first initial interview with my patients, I think I asked about sex twice. So yeah, you have 2 opportunities with someone like me to answer the question. First, I asked, is it enjoyable? And I also asked, are you having sex? and who you're having sex with, what is that sex like, and so that we can have a comfortable conversation. And usually the patients are shocked and they don't want to answer the questions, or either they give me answers so quick that they just kind of just bag away from it. But we need to make it more normal. We need to normalize talking to your physician about your issues so that we can help you, because that's what we're here for. We're not just here just to help you get through all of your other medical conditions you have, your diabetes, your hypertension, anything else that you have. We can also help you with your sex life, period.
100%. I love it. Thank you so much. Dr. Whaley?
All I can do is literally reiterate what they have already shared, but literally just not suffering in silence. Like, I treat so many people who have gone with different issues, pelvic floor issues. We just talked about pelvic pain today, specifically sexual dysfunction, but we treat a whole other array of things. But I just want people to know that if your provider is not listening to you, if you do tell someone something and they kind of brush you off, please don't give up. Medical trauma is a very real thing, and I acknowledge that, but do not continue. You have to continue to advocate for yourself. You have to reach out to someone, do what you can to advocate for yourself. I know that's not the easiest thing. There are a lot of people out here, especially women of color, who are trying to coach other women of color in these scenarios with these power dynamics with providers. So please don't give up on yourself. Like, if someone is not listening to you, continue to fight in that way. That's what I would say. Just don't lose your voice and don't suffer in silence.
Thank you so much, Dr. Whaley. I love that. And thank you all to our wonderful guests. I want to go ahead and excuse our guest. I thank you for joining us. And I want to bring on our crew just for some last minute daily prescriptions, take home messages. So, ladies, that was a packed show.
Yes, it was.
Yeah.
It was good.
Really good. Our experts were amazing. I learned so much from each and every one of them. I want to know what you took from it and what you want to leave as an expert in our own rights, right? I mean, we see different aspects of this, right? We see people coming in an acute care setting. We're all emergency practitioners in a sense. We work in acute care or urgent care settings. So we see when sex goes bad, which, by the way, our next series, because this is a series on women's sexual health, is going to be When Sex Goes Bad. So you won't want to miss that. Stay tuned. We'll tell you the dates. But what are we leaving with our viewers?
There's help out there. I know coming into this broadcast, I did not realize how much information was out there for us, because we're forgotten. You know, like there's been the blue pill for almost 30 years now, but who knew that there was a pink pill? Who knew that there was help out there for us? Right. There's help out there. We don't have to suffer in silence. They have all these professionals that are out there to help us. So go get help. Go seek help. If you're not satisfied, if you're not happy, there's help out there for you.
Right.
Awesome.
I would say that a lot of times I'm an advocate for having Black practitioners. Like, I have a Black dentist, I have a Black OBGYN, a Black PCP.
Period.
I know much about that. A lot of times I hear stories about people going, especially Black women, going to their PCP and feeling like their voice is not being heard, but having Black practitioners, Black doctors that's advocating for sexual health with women, it's just a reminder that our voices are not going silent. Like, you can still have people that's advocating for certain things that aren't particularly seen as pertinent in healthcare. So a lot of people don't visualize, or they don't recognize sexual health as being a part of your health, but it's important. It's important in your quality of life. So I think just having these conversations and reiterating that sexual health is important, it's a good reminder to take home with our viewers tonight.
Awesome. I agree. What else are we doing?
I want to say that I want people to not be afraid to find out about you. I mean, women, these are your lady bits. They've been yours your whole life. They're going to be yours for the rest of your life. Find out about your lady bits. There is no shame in figuring out what you like. There's also no shame in asking questions or telling your partner what you like. Yes. I don't have any sisters. One of the things my brothers told me was that one of the biggest thing a woman can do is become completely comfortable with herself. And I feel like this is a kind of a one of the rooms in that house of that type of thinking.
I hear that.
And I know for me, I'm hoping that anybody that watches the show just recognizes that also that their sexual health. I mean, definitely they come and see us for whatever moment of time, but this is an ongoing discussion, an ongoing concept that they should really be embracing and taking onus of it. So I'm hoping that this will create different mindsets for women from the standpoint of saying, you know what, hey, this is an important part of my life and who I am and what I am. And and that having more robust discussions, even when it comes to like their friends, and definitely, you know, when they go to their providers, and having good, robust discussions, and knowing that, hey, listen, if you know, finding somebody that's, you know, if you don't feel comfortable talking to that one person, or you don't feel like they told you what you needed to hear, there's so many others that you can go and see. So don't be discouraged. Also, from the standpoint, if you might not get the response that you want, go find someone else, because, you know, hey, as we saw with these great guests, there are some fabulous women out there that are taking care of women.
Yes.
And just know that they are out there.
They are totally out there. I am so happy for this show. This is actually one of my favorites, and I'll tell you why. Because we're taking something that's usually just chit-chatted about in small circles and people kind of giggling, and we're making it a real issue and normalizing, discussing it like a medical issue. Because as has been stated several times throughout, sexual health is actual health. It is an integral part of your actual health, your overall health. We talked about how it can impact the different things that we traditionally think about as healthcare, your blood pressure, your cardiovascular health, how you sleep. It's important for us to talk about it, and it's important for providers, we as healthcare professionals, to open the door for patients to ask us questions. So even when it's busy and even when they come for other things, we have to be open to answer these questions for them. Because let me be honest with you, as women, we're going to get questions that some of our male colleagues will not get from our patients. I remember being in my residency, and I was on the cardiac intensive care unit. So these are patients that needed heart transplants. And when I went in to see one of the patients, after everyone had rounded on them, I went back to just ask her a question. And the only thing this woman wanted to know from me, she didn't want to know about her heart or her kidneys, which were not doing so well. She's like, I'm having itching down there. And I couldn't tell anybody. Can you help me? Is that going to stop my surgery if I get a heart? Do I have a bad disease? So I bring that up just to underscore that we have to listen. We have to be that doctor or nurse, a BFF for our patients, as well as advocates for our patients. Women's health, women's sexual health are important and worthy of discussion. And I'm so happy that we were able to have this discussion. I want to thank our viewers who have rocked with us to the very end. I want to thank our guests for joining us. You all are amazing. I've learned so much from you. I want to thank you all, our amazing hosts, because you add to the discussion. You ask those questions. You give me life with those expressions. But this is a topic that needed to happen, and I hope that you all have learned something from it. Stay tuned for the rest of our series. We will have more coming out on this matter.
As a matter of fact, we have more for you. We want to invite you to our private after show. This subject has been such an incredible journey for us because we've had the opportunity to hear from you about the kind of things that are on your minds about your sexual health. And we as women providers, we have our own perspective too, some which we've been able to share with you and some which is really more for behind the scenes, if you know what I mean. So please feel free to join us on the after show. It is a private show, so we're going to have to send you the link. But in that show, we had the opportunity to answer some of the questions that you sent us that we didn't get quite to. And we had the opportunity to just kick it and really discuss openly and freely our perspectives on women's sexual health as women healthcare professionals and as women, wives, mothers, girlfriends, sisters. So text or email after show to whendocstalk@gmail.com and join us for the after show. We can't wait to see you there. Take care, and we'll see you next time on When Docs Talk.
When dogs talk, when dogs talk, when dogs talk, when dogs talk. When dogs talk, when dogs talk.